Hello, everyone. So, I'm going to present on the Safe Maternity Initiative Tanzania. My name is Dr. Benard Mtalemwa. I'm from Singida, but I'm from Singida, Tanzania, but I work for the organization which is named the Peri-Urban Ambulatory Nexus Tanzania, PANETA. So this is the current initiative that we are taking. It's called the Safe Maternity Initiative Tanzania. In short, we call it the SAMITA. So next. So the initiative was initiated by our organization, but we are actually collaborating with the Rotary Foundation. So the Rotary International, the Rotary Club of Windsor, and so forth. So we have been working with them in this initiative, which we call Safe Maternity Initiative Tanzania. And now next. Now, just to know a little things about PANETA, it's called the Peri-Urban Ambulatory Nexus Tanzania. That is an organization, a non-governmental organization, which was registered here in Tanzania under the Non-Governmental Act of 2002. And the vision of the organization is to be the leading voice for health and the wellness of underprivileged rural communities of Tanzania. So, since 2023, PANETA has been collaborating with the Rotary Foundation to implement a 5-year Safe Maternity Initiative Tanzania SAMITA program. And the program is aimed at saving lives of women and the newborns who are dying due to complications before, during, and a few days after delivery. Go again. Now, for our program, this is the approach which we use to reach or to implement it. Can you go to the next slide? Yes. The first thing was to select the site where we wish to implement the program. So in that case, we selected the Siha District Hospital, the Siha District Council of Kilimanjaro region in Tanzania. And this was the initial phase of the program. We used the Siha District as a pilot. So what we do is to conduct trainings to healthcare providers in Siha District on helping mothers and the babies survive program, together with the use of the non-pneumatic and shock garment NSG in management of obstetric hemorrhages. Now, introducing NSGs, we also do introduce NSGs to traditional birth attendants in Siha District to ensure awareness on the device among women in the district, and therefore to easy acceptance of it, because we found out that some women feel like it's a very new technology and they are not sure about it. So we felt if we use these traditional birth attendants and introduce it to them, then they would spread a message and knowledge to the rest of the women in the society so that they can accept the use of the device. Next. We supplied 31 health facilities in Siha District Hospital, in Siha District, from primary to quaternary facilities with NSG species, and we supplied them depending on the number of deliveries which are conducted in the facility per month. Again, we prepared the site visit plan and the checklist, whereby the facilities are being visited regularly to ensure adherence to standards of the NSG usage, which usually range from application, removal, cleaning, folding, and even storage of the device. Also, supervising retraining programs among the healthcare providers. We are also conducting data collection and analysis, and we are using the Kobo Toolbox application for this data collection. Yes. Next, please. Now, from what we have been doing, especially on the data collection, there are some of the findings which we have found out, and these are the current findings which are in the site. The first thing we have found out is that the facilities ranging from primary level to quaternary levels are utilizing the non-pneumatic and shock garments. But we also realize that more trainings and retrainings are still needed, because we need to minimize the knowledge gap among healthcare providers on the NASG utilization. Also, facilities which did not conduct deliveries. Remember, in the previous supply, we supplied the facilities which were only conducting deliveries, and we supplied them depending on the number of deliveries they conduct per month. But now we realize that facilities which do not conduct deliveries are also likely to receive at a first place sometimes patients with obstetric hemorrhages, and therefore they need the trainings and the supplies of the NASGs. Yes. Now, another finding which we have realized is that the current NASG storage practices in some facilities did not render easy access during obstetric hemorrhage emergencies. Some of the NASGs are being stored in the store there, and then which we think it could be a little bit difficult for the person having an obstetric emergency to access the NASG. And again, we realize that the current supportive supervisions which are being conducted by the council and the regional health management teams and the other stakeholders who are doing some supportive supervision to the facilities in the Siha district, they do not have NASGs as part of their supervision checklists. And another finding which we have realized is that expansion of the NASG project to other districts and the other regions is now becoming a vital importance due to its proven life-saving role in obstetric hemorrhage. Yes. Can you go next? Can you go to the next slide, please? These are the way forward. Now, the first way forward, which we think is very important, is to introduce and supply facilities with PPH cards that will be enough to accommodate, among other things, the NASGs. Remember, we talked about the way we are storing the NASGs in the stores and somewhere like that. It seems it's a little bit difficult to access them. But when we found out that there were PPH instruments which are being used at devices and some drugs, they are packed somewhere safe and easy to access. So we think NSG being one of the devices which is going to be used for obstetric hemorrhage, and then we think it's very important to be included among those devices which are like the PPH cards. So we are thinking of introducing and supplying the facilities with these PPH cards which are big enough to accommodate the instruments or devices and the drugs for PPH, but again, including an NSG. And the other thing which we are thinking is that to conduct more trainings and retraining programs during the site visits and they have more pieces of replacement, but again, supply the facilities which do not have NSG. Remember, we do not supply NSGs at all to the facilities which do not conduct deliveries. So there are some facilities which do not conduct deliveries, but they are most likely to receive patients with obstetric hemorrhage. So we thought is very important, and now we want to supply them with some of NSGs and as well as to train them. So we also need to involve the council and the regional health management teams in the program. Why do we want to do this? Because we need to incorporate NSGs. We want them to incorporate NSGs into the supportive supervision check area, so that when they are doing supportive supervision, and then they including an NSG as part of the checklist, or it will become easier for them. We give them some trainings, we supply them with some NSGs for training. So when they go to the facilities for supportive supervision, then they can go through some of the issues. Next. Again, we want to conduct regular updates on the data collection questionnaires in the COBOL toolbox, which we are using. We want to make the data match with the current situation in the facilities. So we are going to be doing a current or daily updates to the checklist which we are using. Now, our organization is now trying to look for alignment with similar-minded individuals and even organizations, because we need to expand the project's reach through strategic partnership, conference, and even targeted outreach to create a sustainable national program. Next. And now these are the conclusions. The NSG and its potential to save lives is being compromised by persistent systemic gaps. And these include insufficient training, incomplete or absent data documentation, poor cleaning and storage practices, and even lack of accountability in implementation of the program. So additionally, there are limited administrative support and a high staff turnover, which also further hinder effective NSG utilization. So to maximize its life-saving potential in obstetric hemorrhage management, urgent actions are actually required. Retraining of the healthcare providers, standardizing storage procedures, enhancing supervision, and ensuring consistent data recording. So strengthening these areas is very essential for improving maternal health outcomes and maintaining alignment with the Safe Maternity Initiative Tanzania program, which we are actually implementing. Yes, thank you.
Okay. So Baraka started to share the screen.
Yes.
I think this is our 2024 VTT, which we did last year, November. Mm-hmm. So the first picture shows the picture of master trainers, the team from PANETA and the team from Canada, with some of the healthcare providers who participated in the training.
Okay.
And if you can just be able to scroll down, Baraka, you can just go up. So you can see the Maasai Mamas, those are the traditional birth attendants. We also trained them, but we did not give them the pieces. So, but at least they know, they have that picture about NSG, how to apply it, and at least they know that if there is any mama that is bleeding around, they can make a call that at least we need NSG. We don't tell them that it's NSG because it's not easy for them to mention the name. So we're trying to find a Swahili word. We call it kiokoa maisha, a life-saving gaun, something that's easy for them to memorize. So you can see some of other pictures involve. We're teaching them how to help the babies, to breathe when they're born and they're not breathing. So you can see from the pictures on helping mothers and baby survive program. Mm-hmm. And if you scroll down, you can see now that we are distributing the pieces. So now that is if you see like the number of the pieces. We give the facility according to the number what they need.